Usually, if you have been to OPD of a physiotherapy, then you must have seen a very common issue of the shoulder, which might not be that common, but as per the Parche of hospital, you will see the client is having frozen shoulder. Any kind of pain doesn't matter. The diagnosis is frozen shoulder. So today I'm going to tell you some of the feature how you can distinguish whether it is a frozen shoulder or is it a tendinopathy. Because mostly in shoulder joint, these two things are very common. Rotator cuff get injured or something happened, then tendinopathy is common. But if there is no actual cause of it, onset of the problem is insidious, then it can be frozen shoulder. How about activity? So in frozen shoulder, activity won't decrease the symptoms. But in case of tendinopathy, after the day-to-day activities, pain gets subside. For the frozen shoulder, in the initial phases as well, there might be some capsular pattern which will involve. You might not be able to see a huge difference in the range of motion, but there will be some amount of stiffness in the external rotation and some restriction you will find as per the capsular pattern of the shoulder. But in tendinopathy, there is no such pattern involved. And there are some specific points which cause more pain as compared to the other. For frozen shoulder, there will be no as such history of trauma. It can be due to metabolic disease like thyroid, diabetes, or if someone had any surgery in the past, which can lead to the frozen shoulder cases. But in tendinopathy, you will always find a sudden increase in the load. So load is not that someone has started doing gym training or something like that. In those people who are inactive since long, and if they have done something more aggressive than their usual activity, then it can lead to tendinopathy as well. For frozen shoulder, people are in their late 30s, mid 40s age, but tendinopathy can happen with any age group. I hope these differential diagnoses will help you to assess your patient right and treat in a holistic way. If the person is having frozen shoulder, in the initial phase, corticosteroid injections are very good as per the research article. So don't delay till it gets worse and signpost them to the right place. I hope this helped. Follow me for more such videos. Till then, bye-bye.